Real quick, I want to explain something about medical bills that many people are never told and that important actors in our health system rely on you not understanding. My name is Caroline Waltzman. I have a master's degree in health administration and a global cert in health operations efficiency. I work in health policy and systems. And one of the most difficult truths I've had to come to terms with throughout both my work and education is that our healthcare system doesn't have to be as confusing as it is. But for many of the powerful organizations at play, they integrate our collective confusion into their financial and business plans. When people are confused about what covered means or why their claim was denied or why the price of a procedure or appointment changed depending on which hospital we went to, these things play in their favor. If this were you would probably assume you missed something or did something wrong, but most of the time, we haven't. The complexity of our health system benefits very specific parts of the system: insurance companies, pharmacy benefit managers, and billing vendors, because these moving pieces in our system make costs harder to track and decisions harder to challenge. It leaves us wondering, who do we even call about this problem? The hospital's sending me to insurance. Insurance is sending me back to the hospital. When these responsibilities are spread across many organizations, accountability gets blurry very, very quickly. I want to be very clear about something. Your doctors, nurses, and pharmacists are not the ones making these financial decisions. Many of them spend hours of unpaid time fighting insurers on your behalf to make sure you get the care you deserve. When people do not understand how this system works, their frustration gets directed at the wrong places, toward our clinicians, our vaccines, and public health, instead of toward the business structures that are actually driving the decisions we have to make. So, if healthcare has ever made you feel overwhelmed or embarrassed, that is not on you. You should not be responsible for carrying the weight of a systemic problem. And understanding that is the first step toward changing it.